Thank you very much. And nowadays, for advanced metastatic endometrial cancer, most of them will be treated by, the backbone will be chemotherapy. And then nowadays, we also have immunotherapy, which plays a very important role in this scenario as well. But then for pMMR patients, that means non-dMMR patients, actually their response rates or the other benefits from the immunotherapy actually is not as prominent or not promising as patients with dMMR. So that's why for my talk, I basically went through the immunotherapy profiles or the response and also the performance in patients with pMMR patients. And then I also touch on like adding some other agents like TKI or Bevacizumab or PARP inhibitor in combinations with immunotherapy in this setting. And then at the end, I also gave some examples of what are the novel agents that could be considered. For previous experience with Bevacizumab or TKI, or basically mainly Bevacizumab together with chemotherapy, in fact, some meta-analysis shows that the benefits was not very good, unlike other cancer like ovarian cancer. So that's why I think for Bevacizumab is not a routine in advanced metastatic endometrial cancer. And then honestly, there are not too many studies looking specifically about chemotherapy, BEV, and also immunotherapy in advanced endometrial cancer. There's some ongoing study, but the results was not available yet. And we also had one study called LEAP-001, which looked at pembrolizumab together with lenvatinib. They tried to see whether this combination can replace chemotherapy at frontline setting. However, this one was a negative study, which it shows that the benefits in the overall ITT intention to treat population, actually we couldn't see a benefit as such. And then obviously the benefits in pMMR patient was not promising at all. There's some benefits apparently in dMMR patients, but then because of the design of the study, we still could not use this results sort of like evidence to replace chemotherapy.